The State Commissioner for Health, Professor Akinbayomi, declared that mandatory health insurance and stronger public-private partnerships remain the cornerstone of its healthcare financing reforms as it moves to close an estimated 100 billion naira gap between current health sector funding and projected healthcare needs in the state. He made the comment at this year's ministerial briefing commemorating the 7th year of Governor Babajide Sanwo-Olu's administration. Let's hear from him.
The Lagos State Commissioner for Health, Professor Akinbayomi, arrives at Alausa Ikeja for the 2026 ministerial briefing to give account of the achievements recorded in the last 1 year of Governor Babajide Sanwo-Olu and Kadri Hamzat-led administration. According to the statistics shared by Professor Abayomi, Nigeria has 40,000 doctors at a ratio of 1 doctor to 5,000 population, with an urgent need of 300,000 doctors, while Lagos requires an additional 40,000. In delivering better healthcare services, the Lagos State government is developing an ecosystem that can address biosecurity threats, enforce mandatory health insurance, and neutralize outbound medical tourism.
This is a huge number. And let me just say, for the record, that human resources for health shortage is a global phenomenon. It's not an Africa problem. It's not a Nigeria problem. It's not a Lagos problem. It is a global problem. It's a phenomenon. The problem is, however, that Europe and America are able to attract the doctors and nurses and professionals that we produce abroad because they seemingly have a better environment to work in. But things are changing fast. Lagos is narrowing that greener grass on the other side. The grass in Lagos is getting very green, and in fact, we're beginning to experience doctors that are coming back. We want to reduce brain drain, and we want to increase brain gain. So what is the strategy? Well, we need a healthcare financial reform that's critical because it's all about money. We need to improve the working conditions of our healthcare professionals. We need to improve the living conditions of our professionals and facilitate the return of those that have already drained out of the country. We are making sure that the health sector is robust enough to manage anything that comes our way, including biosecurity threats, such as we have seen with cholera, diphtheria, Lassa fever, COVID, flu, and so on. For us in health, we're able to deliver universal health care through a strategy called mandatory health insurance, and this covers a whole charade of activities. And number two, becoming neutralizing outbound medical tourism. So we don't want any Lagosians to leave Lagos to obtain any form of healthcare abroad in Dubai, in London, South Africa, India. We want to be able to provide every kind of specialty and subspecialty to our citizens in Lagos, and in so doing, neutralizing outbound medical tourism and reversing it, in fact, and contributing to the GDP of Lagos, as happens in many parts of the world. Dubai, India, are realizing billions and billions of dollars in terms of medical tourism, and Lagos wants to participate in that. And we are, at the moment, in terms of the city that provides the best healthcare in Africa, we're now at number 8 after Cape Town, Johannesburg, Morocco, Egypt, Nairobi. Lagos is now number 8, and we're hoping that over the next 5-10 years, we can move up to at least somewhere in the top 3.
The state government is currently working towards establishing a University of Medicine to expand training of medical professionals.
His Excellency has given us the approval to establish the standalone University of Medicine and Health Sciences. And this is a collaboration between the Ministry of Health, Ministry of Tertiary Education, the Attorney General, Ministry of Environment and Physical Planning and Urban Development. And the strategy here is, typically, we've been training our professionals in the green circle, which is our tertiary hospitals. But we have the yellow, the red, and the blue. These are huge assets that Lagos has in terms of general hospitals, PHCs, and in fact, private sector hospitals, military security facilities, and many, many diasporians abroad who want to participate in delivering healthcare to Lagosians. So what we're going to do is we're going to decentralize the training of our healthcare professionals from the green circle through the yellow to the red to the blue, which means that we will have access to a very large number of patients. So for example, in our general hospitals, we see year in, year out about 7 million patients a year. And in our primary healthcare facilities, we see about 13 million. So when you add 7 to 13, you're talking about 20 million patients in the public health sector alone in Lagos. That is enough to train thousands and thousands of medical professionals, because medical professionals are like apprentices. They need patients to learn. Doctors and nurses learn by the bedside. They learn in the clinics. They learn in the theaters. And if you don't have patients, you can't make professionals. But Lagos has millions of patients. And so it's an asset for us that we must capitalize on to become the center of medical professional development in Africa.
The blueprint for medical infrastructure transformation is also top priority for the government in ensuring that healthcare facilities are well maintained.
There are many assets to this. It's all about design, patient experience, maintenance, and energy, which were not incorporated into the facilities that we have at the moment. So we've built in sustainable concepts utilizing design technology from all over the world, collaborating with Lagos architects to develop what we describe as our green blueprint designs for the future of Lagos. We've looked at sunshine, we've looked at renewable energy, we've looked at ventilation and the movement of the sun, and we've designed our new facilities over the past 4 years to be able to incorporate what we call sustainable renewable designs. And these are some of the attributes, including solar technology. Now, if you look at this chart, you will see that on the right is the average hospital that is not built with renewable configuration, and it costs us 158 million naira to power a non-renewable energy hospital. Whereas our green hospitals, which are the future, the cost of powering those hospitals drops from 158 million to 61 million, which is a 96 million naira saving on energy. And as the cost of energy keeps rising, this is a significant development for us. Now, in the primary healthcare sector, we've developed 3 prototypes: the small, the medium, and the large. And here's the large. It's a very impressive structure. It took us 3 years to develop this design. It has an outer fenestrated sleeve with a roof, a false roof, and inside this fenestrated architecture is the PHC. And you can see there that our waiting rooms are not inside rooms, they are outside, so that we reduce the opportunity for infection transmission between people who are coming to access health. So our waiting rooms are in these outside corridors. Although it's covered and protected from the environment, it is ventilated and protects our patients.
The Lagos State government believes that the ongoing infrastructure modernization in the health sector would help address shortage of medical professionals. Government also encouraged residents to report any form of irregularity that threatens the safety of patients to the Health Facility Monitoring and Accreditation Agency to ensure healthcare standard across the state.